Hey, and welcome back. We're still on all about diabetes medications here for the Diabetes Eating and Wellness course. Back here with Dana Stallings, and really excited to learn about this next drug class. Take it away, Dana.
We have 4 medications in the DPP4 drug class. Again, the top line you're looking at is the generic name. The bullet underneath is the brand name. So I will go with brand name. This is what you guys are going to probably recognize the most. We have Nesina, Tradjenta, Onglyza, and Januvia. The last one there, Januvia, tending to be the most widely prescribed DPP4, and then probably the follow-up to that would be Tradjenta. The benefit of the DPP4 class of medication is that they tend to have fewer side effects, as you can see on your third bullet. No weight gain or hypoglycemia, low blood sugars. And that's because, unlike the sulfonylurea drug class that we just spoke about previously, those medications are not selective. When you take your medicine in those drugs, then you're going to get what you are asking for, whether you need it or not. With the DPP4 class of medication, though, it is selective, and so it is only going to work as needed. And in this case, that helps us to reduce the amount of side effects that may result from taking these medications, which is the primary benefit to this class of drug. So we have a hormone in our stomach. It's a GLP-1 hormone, which stimulates insulin production and also helps us to lower our glucose levels after we eat. The DPP4 class of medications helps our body to hang on to that GLP-1 hormone, which we tend to lose too quickly in type 2 diabetes. And so, in other words, when you're taking your Januvia or your Tradjenta, it blocks the enzyme that destroys the GLP-1 hormone in your stomach, so that we have enough insulin to lower those blood sugar levels after you eat. Again, the side effect profile is generally fairly low in this class of medication, which is one of the main reasons that I prescribe it, particularly in my patients who do not have a particularly high A1C, or especially in the elderly population, because it has so few side effects. We do have a slightly increased risk of pancreatitis, which would be considered a severe side effect. If you start to have nausea, vomiting, abdominal pain, then go straight to the emergency room and let them know that you are on this medication. Even better, grab your pill bag and take it with you so that the hospital knows what you're taking. But in general, you're only going to see very minor skin reactions, some flu-like symptoms or gastrointestinal issues, a little bit of bubble gut, maybe some occasional diarrhea, but in truth, these are not as common as they sound, and you probably will not really have much of an issue with taking this class of medicine.
Very interesting. Okay, so the pancreatitis is a big deal. That sounded scary. How often does that happen? Is it like an almost never type of thing, or is it sometimes?
Thankfully, it's an almost never sort of deal. If you have ever had pancreatitis, it's an inflammation of your pancreas, and this is something that you're usually going to be hospitalized for. So if you ever wonder if you've had pancreatitis, you can certainly ask your healthcare provider if you've ever had a diagnosis of it, but in general, you would have known. But no, this is something that's not going to happen very often. And in particular, it's not going to happen very often in this drug class. We have another drug class that we're going to get into in another module that we will discuss pancreatitis a little bit more extensively, but this is not something that you will see very often.
Great to know. Thank you so much.